So, hi friends, I'm Dr. Anshul Bansal again joining you on this Unacademy platform. In today's YouTube session, we'll study about osteomyelitis and we'll jaldi se rapidly revise everything which is important for regarding osteomyelitis. Okay, very important session for the FMG examination aspirants that is due next month only, and for the NEET PG 2022 aspirants also. Here we'll discuss the acute as well as the chronic osteomyelitis, whereas the salmonella wala osteomyelitis, Gary's osteomyelitis, the Brody's abscess, etc. So we'll study about all of this. So currently I'm working as an orthopedic house surgeon in SMS Hospital Jaipur, and I have cracked the NEET PG examination last year, that is in 2020 only, and I am here to guide you for the subject of orthopedics. And here we'll study in-depth orthopedics so that not only you can crack your NEET PG, INICT, FMG like competitive examinations, but also you can do well in your prof as well as university examinations, and you can build up your concepts very well. Okay, so let's start this session, and before starting I will just briefly guide you about a various subscription plans that are available for the NEET PG on Unacademy. The first one is your plus subscription. The plus subscribers will get access to all our live as well as recorded classes. They can access our entire QBank, and they can compete in live tests and quizzes, all of which is formed by the topmost faculty for the NEET PG in India. And also will allow the subscribers to log into multiple devices with the same account so that they can study on any device of their choice at any time. And also for the subscribers who will be subscribing for 12 months or more, we will be shortly providing them with a printed notes. And while subscribing, you can use my code, that is Anshul B10, to get extra 10% off. The second one and the best one is your iconic subscription, and it is best not only on the Unacademy but across any digital platform for the NEET PG in India. And what makes this best is that sorry, apart from the things that I've told you earlier, वो सब तो आपको मिलेगा ही. In extra में you will get the prep ladder and all of the prep ladder, including its entire QBank, the video lectures, the rapid revision courses, the grand test, everything you'll get. And on an academy extra में you will get well structured live batch wise classes, and we have formulated our batches and structured a course in such a way so as to build your basic concept about any subject or topic first, then going into its in-depth. And also after every test that you will give, the iconic subscribers will get an individual test assessment sheet so that you can analyze yourself ki yes, this topic or this subject needs more revision, and what are the important things that are asked frequently, or what are the important types of questions that are formed from this topic or this subject. So all this is very important in shaping your journey and preparation for cracking any competitive examination. And while subscribing, you can use my code, that is Anshul B10, to get extra 10% off. Special classes are very special. I always emphasize on the special classes because they'll give you extra edge over your competitors, and also you will give a live classroom like feeling where you can interact with your educators, participate in the polls, you can solve your doubts there and there only. You can just raise your hand digitally, you can watch it anywhere anytime. What you have to do, you have to just download a mobile application and log in using my code, that is Anshul B10, both of which are absolutely free. And also after every special class that you will attend, you will also get the digital notes of that special class. So please do attend the special classes. These are very important and beneficial for you. And also please do subscribe and solve a QBank, because not only it contains lots and lots of 25,000 plus questions, but the main beauty of a QBank is that it covers every type of question that is important and that might be asked in your examination. It will cover your entire theory, it contains the recall and the previous year's questions, it contains the image based questions, the x-rays, CTs, MRI based questions, the histopathological slides, and very important, the clinical based and the clinical scenario questions. So everything is included in a QBank, so please do solve a QBank. And also we have launched a new feature which is called as raise a hand feature, and this feature is launched to increase the interaction between the educator and the learners, and also to make this digital platform more interactive. Okay, so you just need to tap on a button so that you can digitally raise your hand, and your educator will come to know about your doubt, which you can solve it there and there only. And also we are organizing a special NEET PG combat test on 28th of November at 5 p.m. This will be a 45 question based test which you have to solve in 60 minutes, and based on your rank and performance you can win exciting prizes and scholarship worth 1 crore rupees and plus. Okay, so top 100 rankers will get scholarship plus exciting Amazon vouchers and other gifts. Okay, so it will be a very important as well as a very interesting thing that you should participate it. For participating you just need to enroll on a mobile application or on a website, and while enrolling you can use my code, that is Anshul B10, and सबसे अच्छी बात is that it is absolutely free. So please do enroll and give this test, and win exciting prizes. Okay, so this is the prize list according to the rank, as well as you can win exciting Amazon vouchers also. Okay, now till 24th of the November we are having a special offer where you can get extra months over your subscription. For 2 years you'll get 4 months of extra free. For 1 year or 12 month may you'll get 2 months of that absolutely free, and for the 6 months subscription course you can get 1 month of that absolutely free. And here are the subscription plans of a plus as well as the iconic subscriptions, and here you can see that the cost per month decreases significantly if you increase the duration of your course. So economically also it is beneficial, and academically also you need to have a single source of information for your entire journey, because you don't want to hop around or you don't want to study different topics or different subjects from different platforms, because it will make your revision and concept building very difficult. So Unacademy provides you everything, so I would suggest you to go for the subscription plan with longer duration, and while subscribing you can use my code, that is Anshul B10, to get extra 10% off. Okay, so let's start today's session about osteomyelitis. So what is osteomyelitis? Osteomyelitis is nothing but infection of bones. Okay, osteomyelitis is nothing but it is infection of bone. Now firstly we'll study about the acute osteomyelitis. So नाम से ही पता चल रहा है acute, so it will be a sudden acute infection of the bone. So there will be all the signs of acute inflammation like pain, redness, severe pain, redness, etc. So it can be, the cause can be of two types, the primary or the secondary. So primary is the most common one, which is due to hematogenous, that is spreading from the blood source. Okay, so most common and the most important type of acute osteomyelitis is a primary, that is hematogenous, and secondary after a open fracture or any open injury. So the infection has already set in, and or any bone surgery that you have undergone, and that converts into the osteomyelitis. So that is your secondary osteomyelitis. Okay, and remember, acute osteomyelitis is most commonly seen in children, and that too in the boys. Okay, it is most commonly seen in the children, and that too in the boys. Why? Because boys is ज़्यादा शरारती होते हैं, so they have more chances of injury etc. in the limbs. So it is more common in children, and most common location जो होती है, it is metaphysis. Okay, it is metaphysis. So most commonly it is metaphysis, because in the metaphysis the vessels are arranged in a hairpin shaped pattern. and the blood flow is very sluggish. So there is hairpin arrangement and highly vascularized zone होती है, but vascularity ज़्यादा है, but speed of the bloodstream is less. So due to this sluggish blood flow, it is the most common site of osteomyelitis. Now, in most of the joint, there is in all joint there is a joint capsule. Now in most of the joint, the capsule is attached till the epiphysis. Okay, that is the metaphysis is extra articular. So metaphysis is extra articular. So in such type of joints, the osteomyelitis will not invade the joint space. The osteomyelitis will not invade the joint space. Okay, now there are certain joints where there are high chances of invading the joint space, and we'll study about them in the coming slides. Okay, now most common pathogen is your staph aureus. Remember, in orthopedics, in any type of infection, the most common organism is your staph aureus only. So option I, so you can take staph aureus. And the most common site is your distal femur. Okay, distal femur or the lower end of the femur, and the metaphysis, as we have already discussed. Okay, now osteomyelitis sets in, there is pus formation in the cavity. Now what are the ways in which it can spread? So first, along the medullary cavity, now out of the cortex by destruction of the bone, it can reach the cortex and through the Volkmann canal, and then the pus may lie just below the periosteum, that is subperiosteally, and from there it can even invade the periosteum. Okay, and it can invade the periosteum, and then periosteum will be perforated, the pus will collect in the soft tissues, okay, in the muscles and etc, and from that it can even perforate them and invade out of the skin or burst out of the skin. Now when the pus gets collected under the periosteum, there is periosteal new bone formation. Okay, there is periosteal new bone formation, and this is called as your periosteal reaction. Very very important, this subperiosteal new bone formation is called as your periosteal reaction. Now as I've told you, the epiphyseal plate is resistant to the spread of the pus. Very very important, you need to remember this, that mostly the epiphysis is resistant, so the pus will not invade the joint cavity because of the capsular arrangement. But in some joints, the metaphysis is also intra-articular, so it can lead to the acute pyogenic arthritis only, and the example are your hip joint and the shoulder joint. So this is very important. In most of the joints, epiphysis will not be invaded, because जो site of infection है, it is metaphysis, and metaphysis is outside the capsule. And so epiphysis is protected by the capsule. But in some joints like the hip joint and the shoulder joint, the metaphysis is also intracapsular, or the intracapsular. So that's why they can invade the joint space. So due to any infection, be it the primary cause or the secondary cause, it will invade the vessels and the bloodstream, and it will enter the bone through the nutrient artery in form of a pyogenic emboli. And in the metaphysis, due to this sluggish flow, it will accumulate there, and it will block the vessels, which will cause the pus formation and the other signs of the inflammation. Okay, so the diagnosis is basically clinically you can have the fever. Okay, in childhood boys में होता है, so classical signs of inflammation like fever, heat यानी warm, redness, tenderness, all will be there. The classical signs of inflammation will be there. So clinically you can very easily identify it. And if you go for the investigation, so in the later stages only you will have the elevated TLC count, and in case of acute infection, obviously the polymorph nuclear leukocytes, that is the neutrophils, will be raised with elevated ESR and the CRP. Okay, and the in x-rays, the earliest sign that you will see will be your subperiosteal new bone formation or the periosteal reaction. So very important, which is the earliest sign of osteomyelitis in x-ray? It is the periosteal new bone formation, but it takes at least 7 to 10 days to appear. And इससे पहले, if you want to confirm the diagnosis, you have to go for the bone scan using the technetium 99, and उससे भी ज़्यादा specific is indium 111 labeled leukocyte scan. So practically we use them very rarely, because clinically we diagnose it very easily. So only for the theoretical and your competitive examination point of view, you have to remember कि 7 to 10 days x-ray में दिखता है इस फॉर्म में, पेरियोस्टियल रिएक्शन के फॉर्म में, एंड उससे पहले इफ यू हैव टू सी, यू हैव टू गो फॉर द बोन स्कैन यूजिंग टेक्नीशियम 99, and more specific for the osteomyelitis is your indium 111 leukocyte scan. Okay, just remember this thing. Now the differential diagnosis of any acute osteomyelitis can be acute septic arthritis. Osteomyelitis is only bone, joint involved नहीं है. अगर जॉइंट भी इन्वॉल्व है, इट विल बी योर आर्थराइटिस कॉल्ड एज acute septic or acute pyogenic arthritis, and you can very easily identify it कि जो swelling या signs of inflammation होंगे, it will involve the joint space. Okay, and also in x-ray also you will see that there will be pathology and inflammation of the joint. Now acute rheumatic arthritis, इसमें you will have the bilateral symmetrical polyarthritis with typical ASLO titers, CRP values, even RF factor, etc. Now scurvy में you sometimes get confused with this, because in scurvy you have subperiosteal hemorrhages which sometimes look like the subperiosteal new bone formation. So subperiosteal hematoma होगा, but there will be, obviously there will be absence of the clinical acute inflammation के signs. And acute poliomyelitis, the neurological and the muscle weakness, you can differentiate it very easily. Okay, now acute osteomyelitis में क्या होगा? There will be pus formation or nidus in the metaphyseal region, and it can convert it into the subacute osteomyelitis like Brody's abscess. Okay, and if it is not treated timely, it can convert into the chronic osteomyelitis, where you have the three typical features of the chronic osteomyelitis, that is the sinus, cloaca, the sequestrum or the necrotic bone, involucrum or the reactive new bone formation. Okay, so now treatment of acute osteomyelitis. Acute osteomyelitis के treatment में, if the child is brought to the hospital and identified at an earlier time, preferably less than 2 days or 48 hours, then only antibiotics or rest. Yani in this case you can just go for the conservative management by rest and antibiotics and good fluid intake, good food and good nutrition. You can easily manage the patient. Okay, and you have to protect the bone and the limb for any pathological fracture, etc., by resting the limb in a cast or slab or a splint or a traction. Okay, so the treatment of choice is a combination of the antibiotics. So the treatment of choice is that for 2 weeks you go for the parenteral, that is IV antibiotics. Then after 2 weeks, for 4 to 6 weeks, you go for the oral route. Okay, so you need to give the antibiotics for this much long time, at least for 1.5 to 2 months. Okay, firstly you need to remember this. Secondly, you give the antibiotics in a combination form, which is ceftriaxone plus cloxacillin. But if the child is less than 4 months old, you have to give the combination of ceftriaxone plus vancomycin. Okay, remember this thing, it is more important, ceftriaxone and cloxacillin. Okay, now after 48 hours हो जाता है, then there is involvement of a large part of the bone, and deep of the bone, or the entire medullary cavity is infected. So you have to go for the surgery, and that surgery is your exploration and the drainage, है ना? And the most common complication of acute osteomyelitis is your chronic osteomyelitis. Remember this, the most common complication of acute osteomyelitis is your chronic osteomyelitis. Okay, so acute pyogenic arthritis भी हो सकता है, another complication if it will invade the joint space, like in hip and the shoulder joint. So you have to take extra care of the proximal femur osteomyelitis and the proximal humerus osteomyelitis. And obviously children hai, so in child you have the growth plate disturbances. So growth plate, you can have the destruction of the growth plates, because just above the metaphysis you have the growth plates. So you have to manage them very very quickly. So growth plate disturbances can also occur, so there can be shortening, deformity, etc., and these are the permanent things that happen, so you have to keep a watch. Okay, now secondary osteomyelitis. Secondary osteomyelitis due to open fracture or any operation of the bone or any orthopedic surgery you get. So there will be infection which will set in, and it will lead to the infection of the bone. Okay, so here the symptoms will be less severe as compared to the primary osteomyelitis, and it will be more easier to diagnose because you already have a focus of infection there. Now chronic osteomyelitis are of three types, and most commonly it is due to chronic osteomyelitis secondary to the acute osteomyelitis. It is the most common type. So mostly cases of chronic osteomyelitis will come to you and will give a history of acute osteomyelitis few months or few years back. Okay, so remember this, this is important. Now Gary's osteomyelitis and Brody's osteomyelitis are another type. Brody's abscess is basically a subacute type of osteomyelitis. Okay, remember this. Now pathology, most common cause of chronic osteomyelitis is your as a sequelae of the acute osteomyelitis only. Okay, and इसमें भी the most common cause कि ऐसा क्यों हो रहा है, it is due to delayed and inadequate treatment. It is due to delayed and inadequate treatment. And again the most common site is your distal end of the femur or lower end of the femur only. Okay, now chronic osteomyelitis में the signs of inflammation will be very less. जो typical signs of inflammation होता है, they will be very less. The signs जो मिलेंगे, they will be the characteristic sign of chronic osteomyelitis will be your discharging sinus. Okay, that is called as the cloaca. Okay, cloaca is the discharging sinus, and it is the characteristic sign of chronic osteomyelitis. इसके अलावा you have the sequestrum. In X-ray also you can see very easily that sequestrum. What is sequestrum? Sequestrum is the dead necrotic bone which is surrounded by the granulation tissue, and this also comes out from the cloaca. Okay, and how you will identify कि it is sequestrum or normal bone? First of all, the sequestrum will be pale as compared to the normal bone, and in normal bone, if you'll see the normal bone, and if you'll rub that with a periosteum or some instrument, you will see that in normal bone, a healthy bone, you will have a small punctate bleeding, okay, which will be absent in case of the sequestrum. And also the sequestrum will have a smooth inner border as well as the rough outer border. And the third characteristic feature that you will see in chronic osteomyelitis is your involucrum. Involucrum is the sclerotic new bone formation overlying the sequestrum. So it is new bone formation seen as sclerosis. It is called as the involucrum. Okay, so here you can see the sinus, that is your cloaca, and here the new bone formation, the sclerosis, involucrum, and this dead bone, it is your sequestrum. Okay, here you can see very easily that here is your sinus, here this is your cloaca. Okay, this is your involucrum, and here there is dead bone, here this is your sequestrum. Okay, and here also you can see sinus, sequestrum, here you have the sinus, cloaca, and the here you can see this is the sclerostic part here. Okay, this is your involucrum. Okay, very easy to identify. Okay, so here also you can see this is your dead bone, sequestrum, necrotic bone, the involucrum here, which is the new bone formation, and the cloaca sinus from which the pus and the sequestrum comes out, which is the opening. Okay, this is your chronic osteomyelitis. So here also you can see this is your new bone formation, involucrum. Okay, here you have this sinus, cloaca, and a dead necrotic bone here, which is your sequestrum. Okay, very easy to identify. Now what is sinogram? Sinogram, to know the entire tract of the cloaca and to identify ki yes, what is the main focus, you put a radio opaque dye into the sinus opening, then you go for the serial x-ray to know the entire path of the osteomyelitis and the cloaca. So this is called as your sinogram. Okay, now as I have already discussed, chronic discharging sinus, that is the cloaca, is the characteristic feature of chronic infection, and this is your chronic discharging sinus from the skin. Okay, this is your chronic discharging sinus. Now we will not call it as cloaca, because cloaca is sinus of the bone, not of the soft tissue or the skin. Okay, remember this thing, ये एक बहुत ही बेसिक चीज है. क्वेश्चन एग्जाम में तो नहीं आएगा, बट in your practical terms, practical examination or in your viva, your examiner can make you confused by this terminology. Okay, so remember this. Now इसके differential diagnosis में chronic osteomyelitis, ये तो अपन ने देखा था chronic bacterial osteomyelitis, and most common cause for this is again staph aureus only. Most common cause of this is again staph aureus. Now differential diagnosis में first is your tubercular osteomyelitis. So how will you differentiate between the normal chronic osteomyelitis and tubercular osteomyelitis? In tubercular osteomyelitis, your discharge will be thin and watery. Okay, your discharge will be thin and watery, whereas around the discharging sinus you will have a bluish skin, and very important thing that it will be multifocal. मल्टीफोकल जनरली क्या होता है, इफ देयर इज क्रॉनिक ऑस्टियोमाइलाइटिस यू विल हैव अ सिंगल साइनस, एक सिंगल फोकस होगा. बट इन ट्यूबरकुलर ऑस्टियोमाइलाइटिस सिंगल बोन में यू विल हैव अ पैची इन्फेक्शन विद many discharging sinuses and many focus. So thin watery discharge with very importantly multifocal, it is your tubercular osteomyelitis. Now sometimes chronic osteomyelitis is confused with Ewing sarcoma also, because in Ewing sarcoma also you have the onion peel wala periosteal reaction and lytic lesion, and very importantly in Ewing sarcoma also you have a symptom of fever. Okay, you have symptom of fever. So to differentiate it, it is very easy. First of all three typical signs, that is the sequestrum, cloaca and the involucrum, they will be absent in case of Ewing sarcoma. And also Ewing sarcoma in long bones is diphysial, not metaphysial like the chronic osteomyelitis. Okay, now treatment जो होता है, it is surgical only. Treatment is surgical only. You have to do the surgery. Now there are different types of surgery. You can remove the dead bone, which is called as sequestrectomy. And obviously only surgery से काम नहीं चलेगा. You do the surgery, you send the sample for culture and sensitivity, you start the antibiotics at least for 6 to 8 weeks. Then you after the report of the culture and sensitivity, you change or you modify the antibiotics according to that report. Okay, now sequestrectomy कर सकते हैं. Second is elimination of the dead space and cavity, which is called as saucerization. We'll discuss what is saucerization. And third is where you can only remove the infected granulation tissues and sinuses only. Okay, you don't dig deep into the bone, you just remove the infected granulation tissue and sinuses. Okay, so this is your treatment. Now sequestrectomy, the removal. Now what is saucerization? Saucerization, see it like this, the bone is hollow. Okay, this is your bone. Okay, so you have removed the dead bone, but the bone is hollow, so it will provide a cavity, or it will provide an area for the reinfection, for the pus to set in. But if you excise that hollow thing, so there will be no space for the pus to set in, so you remove the bone like this. So this is called as saucerization, and it is left open for some time, and when the infection is cured and healing takes place, then you go for the grafting etc. Okay, so इसके दो pros होते हैं. That is, first of all, drainage of the wound is very easy, and also repeated abscess formation will not take place. Okay, now there is a newer technique which is called as the continuous suction irrigation system. Okay, where after surgery what you can do, you can have a inflow drain and a outflow drain to continuous irrigate the infected part, so that the infection will not set in. So just remember the name and the image, that's all. Okay, now we'll come to the special type of chronic osteomyelitis, which is Gary's osteomyelitis. So it is chronic नॉन सुपरेटिव, है ना, जो अपन ने अभी पढ़ा था. अब जिसमें क्लोएका, सीक्वेस्ट्रम एंड इन्वॉल्यूक्रम होता है, दैट वाज सुपरेटिव ऑस्टियोमाइलाइटिस. गैरीज इज नॉन सुपरेटिव, यानी no discharging sinus. Very important thing in Gary's osteomyelitis is that there will be no discharging sinus, and it is a sclerosing type of osteomyelitis where there will be very much increased new bone formation or sclerosis around the bone, and most commonly is your shaft of tibia, not the metaphysis. ओके, नॉट द मेटाफाइसिस. सो नॉन सुपरेटिव होता है, नो डिस्चार्जिंग साइनस होंगे, स्क्लेरोजिंग होंगे, एंड शाफ्ट ऑफ फीमर एंड टिबिया. ओके, हियर यू कैन सी दैट इंक्रीज स्क्लेरोसिस इज देयर. ओके, इंक्रीज स्क्लेरोसिस with a necrotic bone in between with no cloaca or no sinus. Okay, this is your Gary's osteomyelitis or Gary's sclerosing osteomyelitis, which is a chronic osteomyelitis. Okay, treatment is same surgical treatment. You have to remove this dead bone and this sclerotic bone with antibiotics, and this is your subacute type of Brody's abscess. So Brody's abscess is again most commonly in the metaphyseal region, and here you have this rim of sclerotic margin. Anna, there is this rim of sclerotic margin. Now what happens here is that the infection is set in, but the inner strength or the immunity of the bone and the patient is very good. उसकी वजह से क्या होता है, the infection is localized and it is localized in form of this jelly type of substance which is called as the Brody's abscess. Okay, so the treatment is drainage and exploration only. Now next is your salmonella osteomyelitis. Salmonella osteomyelitis को आपको एक ही चीज याद रखना है इसमें, that the most common cause is your sickle cell anemia के बच्चे. Sickle cell anemia patients are के अंदर if there is osteomyelitis or bone infection, it will be due to salmonella, and it is again sclerosis होगा and it is diphysial. See in the image. Okay, diphysial, increased sclerosis, and due to infection of salmonella, due to infection of salmonella. Now what is this? What is this? Remember, this is not osteomyelitis. This is your septic arthritis. Okay, this is your septic arthritis, because in the clinical picture also you can very easily see joint में classical signs of inflammation, and in the x-ray also you can see that the joint जो है यहाँ पे you have the pathology, reduced space है ना, and sclerosis etc. So this is your arthritis, not osteomyelitis. So read the question carefully, see the images very carefully, and you will be